Hello, everyone. Welcome to the second episode of COVID Myth Busting and Precautions with Dr. Tanvir Reza, a leading pulmonologist of Kolkata. Today, we'll talk about the precautions that we can take in our offices to keep ourselves safe from COVID. Dr. Reza is a practicing pulmonologist with 24 years of experience. He completed his MRCP from Royal College of Physicians, London. He has also done his diploma in tropical medicine and health. Dr. Reza is an experienced, skilled, and awarded doctor in his field of specialization. Talking about the offices, some of our people who are working from offices, they have to take calls throughout the day. And it is difficult for them to wear masks the entire day and talk. So what are your recommendations?
In a day, I used to, when I'm in a chamber, when I'm in the clinic, I might see 10, 15, 20 patients wearing 2 masks and yet make myself heard. When I initially started teleconsultation and seeing 20, 25 patients, I used to wear masks just to make a point. Although I was not in a clinic and the patient was not in front of me, just to make a point. For example, right now I should be making a point to you guys by wearing 2 masks and talking to you. If you speak slowly, if you speak clearly, if you speak crisply, you can be understood through 3 masks. That is no excuse. You just have to slow down if you think that the others cannot understand you. Even through an N95 masks, I've tried this, I've experimented. People can hear you. If they cannot understand you, the fault is on your side rather than the mask side or the other side of the phone. Sorry.
Fair enough. So how should we handle the seating arrangement in office spaces? Even if we maintain a distance of 6 feet, is it really safe to work in open office where so many people work together?
See, there's nothing called a safe place right now, unless of course you have absolutely open air and blue skies above you. Okay. The moment you have walls, the moment you have doors, windows, your risk keeps increasing. With the number of people sitting under the same ceiling or under the same roof, that risk keeps multiplying. Okay. So what can we do? Even when we sit more than 6 feet apart, we are still at danger of being infected with the coronavirus. It's as simple as that. Okay. There's no running away from this simple fact. So how can we make our offices or our workplaces safer? That is the basic question I ask myself. There are some practical pointers which you can follow. There are some practical pointers which you cannot follow, depending on your logistics. It's very simple. Okay? So let me give you an example of my own chamber. And from there, we can extrapolate to your office. Most of our chambers are AC'd. Most of them have doors, normal, you walk through them. Most of them have windows, normally closed because the AC is on, correct?
Yes.
Now, from last year, I do not close my window. Okay? From last year, I do not close my door. So now I have 2 places where air can go out. From last year, the AC remains on because it just makes me feel comfortable, my patients feel comfortable, despite the fact that the door and window is open. From last year, I've installed a new fan which is directional, which hits the patient directly on the face, and the patient sits right in front of the open door. So the logic is, the fan is behind my head. From here, it's hitting him directly, and he's sitting right across me. Irrespective of the distance between us, even if he sneezes, even if he coughs without a mask, that airflow going to him and then behind him is the open door will hopefully give me an extra bit of protection. Now, unfortunately, not every one of us can have offices or rooms built like that. I agree. So the minimum you can do is have your ceiling fans on. That will keep the circulation going. In the air cons or air conditioners or ACs, you have two modes. One is a closed environment, which we have again in our cars. All of them have it. And the second is an open one, where open air is sucked in and circulated and then chucked out. So obviously it should be in the latter. Fans on. If you have doors, which I'm sure you do, keep them open. And I'm talking about huge floors of office. Okay? I'm not talking about a very small one. Keep those open. And if you have windows, keep those open. Those, along with maintaining the distance and wearing the mask, is the best bet we have right now, the best protection we can give ourselves. Unfortunately, there is nothing else. I have suggested to quite a few offices keeping standing pedestal fans and keep them on the swinging mode. And that should be opposite to the door, which, if possible, you've kept open. So that gets the air going outside. It's air, 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 and air. It's circulation, 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 and circulation. It's got nothing to do with what you touch, the doorknobs and the gloves you wear. It's got nothing to do with that.
Right. What about the meetings in office? We often have meetings with a group of people or one-on-one meetings which cannot be avoided. So any insights as to how we can conduct meetings safely now?
Sure. Everything we've discussed earlier stands. So keep the conference room open, door open, keep the window open, have a swinging fan there, have your ceiling fans on. Over and above those, and the fact that you're wearing masks and you're maintaining distance, over and above everything, specifically for meetings, one, keep them short and sweet. No matter how big your boss is, he can't have so much GAN to give you. And he can always give that GAN or lecture, via email. So don't give me that he needs to stand there and you've got to listen to him. One. Two, the number of participants should be as small as possible. That decreases the chances of one getting it from the other. Three, and this you're not going to like, no food or drinks.
Right. So the food and drinks actually brings me to the next question that I have. What about cafeterias where everybody have lunch together, and obviously they have their masks open while eating? So what should be the safety protocol there?
Okay. Over and above whatever we've already discussed, I'll keep repeating that. I'll keep repeating that ad nauseum because that's the most important thing. Okay. Now for office goers who are eating in cafeterias, for the big bosses, they should just stagger it. This is a suggestion. So don't tell me that, well, you can't have, earlier you used to have lunch from 1 to 2, for example. You can always give some people break from, let's say, even before 12 and stagger it till after 2 or 3 o'clock or whatever. Depending on the food requirements, depending whoever feels hungry earlier, goes earlier, and whoever can wait can go later. It's as simple as that, because again, there is no other shortcut. And remember, restaurants and cafeterias are one places which you rightly pointed out, you cannot wear masks and eat and drink. So they are the most vulnerable areas. They're the most dangerous places where strictly you have to keep the distance, you have to strictly keep the numbers down, and you have to strictly make sure that you eat and run. You don't sit and gossip, and definitely not together. So you're sitting alone, eating quickly, going off.
No talking.
No talking, absolutely. Talk on the phone as much as you feel like.
Right. Okay. And what about those who sit in the chambers in centrally air-conditioned offices? Even if they're not meeting people, do they still have to keep their masks on?
No, is a short and sweet answer, provided there's a proviso attached to it. People don't keep entering and leaving. Okay? If people are, then the person entering should be wearing a mask. at least a cloth mask or a surgical mask, and you should be wearing it too, you who are sitting in the chamber. If you think that no, there are too many people who's going to keep coming and going, as in my case, do exactly what I have done practically. Fan behind me, door open, windows open, ceiling fan on.